Hey friends, welcome back to my channel. I am Nurse Meg and I wanted to make this video because I get questions about this all the time from nurses that have just graduated, especially nurses who take my NCLEX course, 100% pass rate for 3 years, by the way. I'll put a link below down in the description. But they ask, like, what do I say in an interview? What do I wear? Like, what can I expect in a nurse interview? It's gonna be totally different from all my other interviews. Yes, it will be totally different. So I have a blog post about this and I'll put a link down below to this blog post, but I figured I would just make a video. It's so much easier to consume than a blog post. So let's get started. Don't forget to follow me on social media. I'll put links down below. Instagram, Facebook, TikTok. That's where the fun is. And of course my blog, nursemegrn.com. So let's get started. In case you don't know who I am Nurse Meg. I have been a nurse for well over a decade, like 12 years. And I have precepted over 50 nurses. I have a huge passion for nursing students and new nurses. I actually wrote an entire course on how to pass the NCLEX, how to study effectively, how to break down the questions, because I have a lot of friends who create questions for the test bank, and also how to put how to put your brain in the best possible state, including what to eat, how to beat test anxiety, how to break down the questions so that you can outsmart the NCLEX, all of that. I have such a passion for it that I wrote an entire course on it, and then I also have a course called the New Nurse Survival Guide. So I want you guys to survive and thrive in nursing because it's a great profession, but we all struggle at the beginning because there's not enough resources and enough support. And if you don't work in a great environment with older, more senior nurses that are ready to like just grab you by the arm and walk with you, you're gonna struggle. And like I did, I felt like I was drowning every single day and I almost quit in my second year because I thought, I can't do this, I'm not good at this, but I stuck it out and I learned a lot, and I'm going to share it all with you. So let's get started. I feel like I should be qualified to write a new nurse interview tip guide because I have interviewed lots of nurses and hired lots of nurses. I have been in management and been a charge nurse before, so I kind of have that unique perspective of the other side, and I'm going to tell you exactly what I wanted to hear and exactly what a nurse would say to get hired for sure, above all the rest, even if the other person's resume was better. Honestly, they hire based on like personality and work ethic and stuff, but we'll get there. All right, so I'm going to be reading a little bit. You're going to see me look off to the side. I'm going to be reading from the blog post just to kind of keep a little bit of a template so I don't ramble too much and go on any tangents. So when you interview for a nursing position, you're going to be asked about your character, your skills, and your education. Of course, they want to know where you went to school, and they're going to make sure you really did go there. And they're going to give you a lot of scenarios to judge your judgment, whether you are safe, humble, hardworking, and dependable. Those are the 4 things that they're really, really looking for in a new nurse. Even if you don't know anything, or sometimes I would hire somebody for a specialty floor who didn't work in that specialty floor before, just because I felt like they were going to be safe, they were going to be humble, they were going to be super hardworking and dependable. They weren't going to flake on me 90 days after I hired them. So what should you say in a nursing interview? If you have experience working in healthcare, always mention that. So if you have been a CNA, if you have been in home health, if you have taken care of patients or a family member or something, please mention that first. Like, that is going to be number 1. If somebody is coming off working in a different type of industry, it's hard to translate unless it's waiting tables. I loved hiring people who would wait tables and were waiters because they know how to de-escalate situations, they know how to give good customer service, and they know how to be quick. I loved hiring waiters as nurses because they were just on it. So mention those things first in the interview when they're like asking about yourself, like, oh, tell me about yourself, tell me about your experiences. And you want to show the employer that you already come with some great skills to add to the floor. Now let's see, if you want an employer to know that you have patience and you can work quickly under pressure and give great customer service to difficult people, have some stories already in your head prepared that you are going to tell. Preferable true stories. I mean, come on. Also, how do you ace a nursing interview? You ace a nursing interview by showing that you are motivated. Like, yeah, I don't know neuro, but I am so ready to learn. I'm so interested, and I'm motivated. Number 2 is that you work well with difficult people. Coworkers are going to be difficult because it can be a stressful environment. Patients are going to be difficult, and family members are going to be difficult, and doctors are going to be difficult. So if you can communicate that you work well with difficult people, maybe with a scenario to go with that statement, that is a great way to ace a nursing interview. And also that you're great under pressure, that you can think under pressure. Talk about a very high pressure scenario that you had, or a high pressure workplace that you worked and excelled in. That's really going to put you to the top, and you're going to see them like taking notes, like, oh yeah, this one, I like this one. So I have a section on how do you stand out as a new grad nurse. Have stories ready to tell, like I just said earlier. They're going to ask you to tell. They love this. Oh, they have so many templates in all the hospitals that I've worked at, but they're going to be like, tell me about a time where you handled a difficult person or a difficult situation. Like sometimes I feel like they're all the same questions, but they're going to ask you also about a time that like you went above and beyond your job description, something like that. So have those ready. Have those fun stories ready. And if they have a little bit of humor sprinkled in to get them to smile or laugh, great cherry on top. They're also going to ask you if you have experience with certain medical equipment or medications that you've heard of. Always be honest with this. If you have never worked with drips or cardiovascular drugs or certain types of equipment, like, be honest about it. And then if you have never, worked with it, always be like, yeah, I'm ready and willing to learn. I'm a fast learner. Always end it with that if you don't have experience, but please tell the truth. So also in my blog post, I have a bunch of sample questions of what they might ask, which they probably definitely will ask, and what the best answer would be. So I'll read them to you, and then you can kind of like change it up however you want to make it personal for you and your experience and your personality. But let's do it. So what would you do if a doctor or a patient or a family member was rude to you? I like the doctor scenario the most. So what I would suggest you say is, I would kindly ask what I did to upset her or him and ask how I can better assist them next time. Humbleness. You're showing that you're humble and you're a great communicator. Oh my gosh, I would hire them in a second. What would you do if a family member was upset? Answer. I would take the time to listen to them and check with my chain of command to see if we can help accommodate. I would explain what I could about the doctor's diagnosis and treatment and care plan. Fantastic. All right, next question. What would you do if you made a med error or like an error? I would assess my patient immediately. That's what you would say. I would assess the patient immediately. Second, I would tell my charge nurse, my supervisor right away to follow the proper procedures and chain of command. Yes. You would assess the patient always. Patient comes first, and then you would tell the truth. Tell the charge nurse or supervisor, whatever the chain of command is. All right, and then next in my blog post, which of course you will have a link to, I have a sample nurse resume. You don't want to make it too complicated. You don't also want to make it like frilly. Don't be Elle Woods and bring like scented paper or like bright pink. I want your name super clearly at the top with a phone number. And then I want history of employment, your license, your education, and then like qualifications. Like if you speak Spanish, if you know certain inpatient or outpatient electronic things like Meditech, Cerner, Epic, if you know how to use any of those things or have experience with those kinds of programs, those are great to put in. And if, oh my gosh, Spanish speaking is like number one. Like, you guys, half the world speaks Spanish. And if you speak Spanish, oh my gosh, you are so valuable. You are so, so valuable. So don't forget to put that in your resume if you do. I love you. You'll get the job over. All right, so a couple more things that I want to say about the resume. Please don't put your entire job history. If you've had like 6 previous jobs, put like 2 to 3 jobs max, and maybe put 4 if like they're all related to healthcare. But otherwise just put 2 or 3. When you are desperate for a nurse and you are hiring nurses, you don't want to go through multiple page resumes. Stick to 1 page. Trust me, stick to 1 page. If your resume is 3 pages long, I will probably not even read the whole thing and get super annoyed that it's 3 pages. I'm just telling you from a nurse manager perspective, I don't want to read a 3-page resume. I don't have the time. I'm quick and concise, guys. Come on. All right, now let's talk about what to wear in a job interview. There's 5 things that I want you to wear. Number 1 is wear professional business attire and like dark business professional attire. My favorite thing is like dark pants and a dark shirt, like dress shirt. Like that's all you need. Like maybe blue. Just dark color. Don't go crazy with colors because you want them to focus on you and not like your crazy outfit. Number 2, wear comfortable but clean shoes. Don't wear like Crocs or something like that, but wear comfortable shoes, maybe flats. Make sure they are very clean. I don't know why this is something that I always looked at, but I always looked at somebody's shoes, and if they were like super dirty, I was like, I don't know, like for some reason it would like bring things into my head. So just get a little washcloth and make sure your shoes look sort of clean when you're going for the interview. Number 3 is pull your hair back, because I mean, I never have my hair down all like pretty and like this at work. It's usually in like a really tight, messy, horrible bun or ponytail. And they kind of want to like see your face, and they want to see how you're gonna look professionally when you're working. Nobody has like their hair down all messy over a patient. Ugh. Germs. So yeah, pull your hair back if you have long hair. And then wear minimal to no jewelry. This is just, I think, maybe subconscious. Some people see like a lot of jewelry and maybe they make assumptions, but I just like nothing to distract them from your awesome personality and your awesome experience and your resume and who you are. They are hiring you. So yeah, minimal to no jewelry. And number 5 is wear a smile. Nobody wants to hire a sourpuss or somebody who's gonna have a bad attitude. So smile, even if it's fake. Acting. So that is it. Thank you so much for watching this video. I hope that this video helps you get hired as a nurse and gets you your dream job. Don't forget to like this video. Subscribe to my channel for more fun nursing content. I have really helpful resources. I have really funny comical videos, and I also have ghost stories from the hospital, so stick around for that. And I have even more of that kind of content on social media. I post every single day on TikTok, so come and find me there. Of course on Instagram and Facebook, because who isn't there? And of course, everything comes together on my blog, nursemegrn.com. Thank you so much for watching this video, and I will see you next time. Bye.